Hi everyone, I'm Grace and I'm going to be demonstrating how to administer heparin via continuous infusion as well as performing chest tube care. So I'm going to perform hand hygiene. So first I have heparin here. It has been primed by the previous nurse. However, I'm going to be administering it. So I'm just going to perform my first check, which includes comparing the physician's order to the MAR. So I have the physician's order here, the MAR here. So it is for Holmes Wendy, which is my patient, correct VIN number. It's by Dr. Jackson. So the date ordered is for today. The medication is 1350 units per hour of heparin. And so I've calculated that to be 13.5 ml per hour, which I'll make sure is right with a colleague guardian pump. And it's been signed by the physician, and it's time for now. And the concentration is going to be 100 units per ml. So I'm just going to look at the bag, and I have prepared a label for the bag just because I want to know which rate it's going to be going at, and yeah, so I'm going to put the label on the bag here. Alright, so I'm just going to take this, I'm going to compare it to my MAR now. So this is still part of my first check. So it's for Wendy Holmes, it's heparin, the dose is 1350 units per hour, which will be 13.5 milliliters per hour. I'm also checking the bag, it's intact, it's not expired. And it's scheduled for now, and it's going to be given IV continuous. So I'm just going to put this here for now. Alright, so now I'm going to also check the parenteral drug monograph while I'm at it. Okay, so looking at the drug monograph for heparin, so it's an anticoagulant, which my patient is receiving for the current deep vein thrombosis. And it can be administered by a student nurse. The IV continuous usual dose is 18 units per kilogram per hour, and I've calculated it, and it is 1350 per hour, units per hour. The max dose alright, just look at the IV continuous colleague guardian pump. So 25,000 premixed for a venous thromboembolism. It's 250 ml is the for the diluent, and we get a final volume of 250, final concentration of 100 units per ml. It's compatible with the normal saline, which is the bag that's running right now. Some potential hazards is bleeding thrombocytopenia, which I will notify the patient of, and obtain baseline aPTT and CBC, which we already have done. So now I'm going to be entering the patient's room. So upon entering the patient's room, I'm just going to do a quick safety check, perform hand hygiene, introduce myself. Hi, I'm Grace. I'm going to be your student nurse today, and I'm going to be administering your heparin infusion as well as doing your chest tube dressing change later. So I'm going to compare my physician's order to my MAR to the armband. So it's Wendy Holmes, VIN number is 123456789, and the patient has confirmed this. So I'm going to now inform the patient so that you're receiving this heparin because of your existing venous thromboembolism, some signs you may experience, some potential hazards you may experience is like bleeding and thrombocytopenia. Please let me know if you experience that. And the patient has a right to refuse, but they want this medication. Right, so I'm just going to set up my pump now. Right, so I'm going to press primary and go to colleague guardian, go all the way down to heparin. So heparin VTE, so that's for thromboembolism. I'm going to be selecting this. So again, it's 25,000 units, that's correct, 250 ml, which is correct. Final concentration is 100 units per ml. The dose, however, is going to be 1350 units per hour. And I've already confirmed that it is 13.5 ml per hour. Of volume to be infused is 250 ml. So before confirming, I'm going to have another nurse with me check this medication, since this is a high alert medication. So we have our MAR here, and I have the nurse with me, and we're going to go through the medication. She'll go through the MAR, I'll look at the bag. So we're going to compare the patient, Wendy Holmes, VIN number is correct, and the patient has confirmed this. So just looking at the medication, it is the heparin, 1350 units per hour, which will be going at 13.5 ml per hour. It's going to be given IV continuous. It's the right route, and the time to be scheduled is now. And she has also confirmed all my program settings. So now that we've done that, I'm going to attach it to my patient. So this here is the primary. And this is my continuous. So this is going to be going into the Y side, which will be connecting to my patient and going through together. So I'm going to just perform hand hygiene once again, and then put on gloves. Okay, so I'm just gonna assess the site. The patient isn't complaining of any pain, and there's no redness. So I've already done my 3 checks. I'm going to alcohol swab the port for 30 seconds. Let it dry for 15. So let's say I've done that. I'm going to remove this, maintaining sterility. Okay, and I'm going to connect it. Right, now that it's connected, I'm going to just confirm the primary. Again, just checking all my, and then I'm going to press start. Alright, and just ensuring that the tubes are not occluded, there's no clamps. For the purpose of this demo, since I'll be performing chest tube care, I'm just going to put it on standby for now. Okay, so now that's on standby. Right, so now I will be performing chest tube care. Just gonna move this to the side. Okay, so follow me as I go to the continuous slow section. I'm gonna be checking the patient suction. It is in continuous slow. This is all intact, following the tubing, and then we're gonna go to the other side. This would be closed, so that's fine. Okay, so now the patient's position is already at semi-Fowler's. I've already explained the procedure to the patient. I'm going to now place the... So I'm going to do my safety checks here for right now for the demo. Right, so we can down here. So I'm following the tubing again. It's connected to this collection chamber here. So there's sterile. So it has continuous bubbling, which should not be happening. It should be gentle tidling. So we're gonna figure out why there's an air leak in the air leak meter. It's 20 centimeters of H2O, so that's good. The orange ball should normally be present, but this system isn't intact right now. I would also document the drainage at the beginning of my shift. I don't have tape right now, but I would do that. And then we're gonna follow the tubing up here. Hence, look at my patient's site. So just moving their arm up. Alright, so that should not be attached to the patient. So now I'm going to check why the bubbling is occurring. Also, just part of my safety check, I would also have sterile water here, just in case the tube was to disconnect, I could attach it. So I'll keep this at the bedside. I would also, if the tube was to dislodge, I have gauze and dressings here. Gauze, dressings, and tape to create a 3-sided dressing. So I'm going to first clamp to figure out why my air leak's occurring. So first I'm going to clamp closest to the patient, and the bubbling has stopped, so I know that the air leak is inside the patient. However, if the air leak was not to stop, I'd leave this clamp on, move down in segments until I figure out where the air leak is occurring, and change that part of the system. So since the bubbling stopped, that means the air leak is inside the patient or within the dressing. So we're going to change the dressing and figure that out. So the dressing's dry and intact. There's no shadowing on the dressing. Alright. And I would also address any need for analgesia prior to changing the dressing, so I'm going to perform hand hygiene one more time.
It's important to keep the bottom.
So I'm going to first set up my sterile field.
For the rest of this. And also I've just assessed the site here, made sure there are shadowing, and
Not sectioning on the way in.
Okay. And it's fine that I touched my sweater because I'm not touching the patient. Okay. Just gonna put this to the side for now. I have all my supplies here. Okay, so I'm going to open up my tray.
And then sectioning sterile water to clean up my tummy.
garbage can. Set that up.
I'm going to be a little bit more careful.
There we go.
So that's set up at the bedside, that's okay.
Just taking a look at his oxygen saturation, and it is still good. So now we're going to check the forceps.
So I'll just put the drip to the side for now. I'm going to set up my garbage.
The whole deal is not, when I put those back in there, this is not sterile. So I would restart this whole thing, put some time into the demo. I'm not going to do that. So
I'm going to now move my forceps
this is the side,
out.
these are the side, those are in. And it's like this. So I put in my
Now I'm going to pour my normal saline. Just making sure not to touch the mouth of the normal saline. I'm going to put this to the side. I have mefix here, and I grabbed extra 1, 2. And on this mefix, I've updated my name and initial, so the next nurse knows when to change it.
Changing the inner cannula.
So I'm going to grab an extra pair of forceps just in case I do contaminate my field. And then I'll need 2 drainage sponges. So I'm going to get that out. Swapping it back, maintaining sterility. There we go. And also I will need a gauze sponge to put above the dressings, above the drainage sponges. And then I also have Jello net here, which I will place.
Okay, so I'm going to start now with the dressing.
It's a little slippery. Let's try this.
Just put my garbage here.
I'm just gonna put this on the side for now. It's good enough. Okay. It's all garbage. Now I'm gonna check the patient's side for subcutaneous emphysema. So just palpating, and there's no crackling sensation, so I know that's not happening. So I'm going to now remove the dressing.
Here, okay, and that's going to be garbage. So now I'm assessing the site and the redness.
So this would be a little easier if I use skin prep, but for the purpose of this video, I'm just gonna be pulling it a little bit harder. Right. And just to note, the chest tube wouldn't be moving a lot just because it would be sutured into the patient's, into the site.
Remove your pillow here. And then open up my.
Right, I'm just gonna stabilize.
Start with one.
Sterile. We're just gonna do another one.
One more swipe further away. So I started from size 7.
And I'll be cleaning the tube, so it's fine if I touch it now. Okay, now that we've gotten that off, I will be now just noting that there's no purulent drainage or anything. I'm going to garbage that. I'm going to change my gloves. Okay, I'm gonna perform hand hygiene. I'm gonna have another pair of gloves to remove the jello net and assess the site.
For me, I would add that to my field. Drying now.
And also just making sure I don't contaminate my field.
Okay, and then removing the dressing here.
Okay, so I'm gonna use my blue forceps to remove my. Okay, and I'm going to discard that. Alright, just to note, I'm gonna first assess this site. There's no signs of infection or purulent drainage. I do realize there's a bit of dressing left, so I'm going to attempt to remove that. And this tube wouldn't be moving as much. And this would be sutured. Right, I got majority of it off. I'm gonna clean it off anyways. So I'm gonna discard these gloves. Perform hand hygiene. Okay, so first I'm gonna clean the site. And I've already assessed it. There's no signs of infection or excessive swelling, redness. I'm going to just clean around the site. One swipe per wipe. I have a rosette here. And then clean one more time around.
It's going to be touching the tray. Sterile. The rest of it I have cleaned.
Now I'm going to
The most important is the middle.
clean the tube.
Just tuck that in here, and then I'm going to get my mefix. I actually use my fingers at the top.
Just one swipe down. And then I'm going to just clean it one more time.
Airtight. And then my second one here. I would have
Okay.
completed
And then I'm all done. I would document my TPN, and also we would be
Now
taking
that that's clean, I'm going to dry the site.
and electrolyte washing for overload of fluid, and as well for the drink. Just documenting
drying
what I
around.
did, how I performed it, the sectioning, and how we tolerated it. So thank you for watching.
tube out. So dating it in the shortness.
So I'm going to dry it one more time.
TPN was
And I'm going to dry the tube itself.
So now I'm just going to clean out my supplies, make sure my patient's comfortable. I'm making sure that I've documented that I gave the insulin.
Now that I've cleaned and dried it, I'm going to apply my jello net around.
So I would like make do dressing as well, that it was done, the amount of drainage, the suction as well. Tap, what the site looked like.
Okay, I'm just going to place this around.
I think that's it. So exit safety check. My patient bed is going to be down, side rails up.
Right, now that it's complete, I'm going to do my 2 drainage sponges.
I dropped it on the floor. Oh, that's weird.
And it's okay if my forceps touch the site just because I have cleaned it.
Oh yeah.
Let's just place again.
And also, why did I put it in content? I was like,
Okay, that's good. I'm gonna place a 4x4 on. And now I'm gonna apply my mefix. I'm just gonna move the gown a little bit.
which
I'm gonna try. And then you have 16 minutes. And some oxygen.
Okay, and then I'm going to use another mefix. And this one has my date, time, and signature on it. So just being sure to tent the piece. Right, now that I'm done, I'd put the patient in a comfortable position. I'd clean all my supplies up, do my exit safety check, which would include putting the bed at the lowest position. Call bell would be in reach, and that is it. Thank you for watching.